Why does Australians for Mental Health have an interest in this particular topic? I think fundamentally it's because if we are only dealing with the treatment side, the supply side of the mental health system, we are only dealing with half the story. Dom Helder Camera once said, and is famous for saying, "When I feed the poor, they call me a saint. When I ask why the poor are hungry, they call me a communist." There is a decent chance that by the end of this session, you will be calling me a communist. Because at Australians for Mental Health, our strategic priorities over the next couple of years will be to look not just at individual issues, not just individual areas where reform might be necessary, but to look much more broadly at whole systems. And to ask, what is the systemic change? What is the structural change that Australia needs to deliver better mental health outcomes across the board?
My first question is, what is prevention? And part of the problem in mental health is that we're a field that is just renowned for having a very fluid and dynamic and sometimes contested language, where different people use different words to express the same thing, and those terms keep changing over time. I think, in lay terms, it's pretty straightforward. Prevention is about stopping something from happening, whether that's a skin cancer, a heart attack, a stroke, or a COVID infection. But in health and mental health, we tend to make things more complicated. We talk about primordial and primary and secondary and tertiary and quaternary prevention. We talk about universal and selective and indicated prevention. We talk about promotion, prevention and early intervention. We just sort of get ourselves tied up in knots. So I want to try to simplify it. When we talk about promotion or promoting people's mental well-being, it's about improving people's mental health, and you can measure that on certain scales that are designed to measure mental wellness or mental well-being, not mental ill health or mental illness. When we talk about prevention, we talk about preventing the onset or occurrence of the mental health condition, stopping things before they start. We're so used to talking about mental ill health. Even the word mental health is really now being used to talk about depression and anxiety. It's not being used in the positive sense. We all have a level of mental health. Sometimes it's in the positive zone, we experience good mental health. Sometimes it's not so good and we can experience poor mental health or a mental health condition. So that spectrum is really important. And what we're trying to do in promotion and prevention is keep people to that sort of well-being side of the mental health continuum and prevent deterioration or decline towards the onset of mental ill health or a mental health condition. There is good science now around what works. And it's come in two directions. It's come from the direction of clinicians who have trialled initiatives where they try to find people who are at very high risk of the condition or appear to be on the verge of developing that condition at imminent risk. And then they provide various treatments and, they trial so many things from low dose, antipsychotics to prevent psychosis, to fish oil, to, cognitive behavior therapy. That's one stream of prevention science. But the other field of prevention science comes from the health promotion, public health approach, and says to prevent these conditions, we have to tackle the underlying root causes. We have to tackle the things that cause these conditions to occur in the first place, or we need to put in place protective factors around people to buffer and mitigate. Now, both are valid. The individualised approach is important and helpful, but you're just really helping one individual at a time who it seems to be at risk. But the public health approach takes a different tactic. It's about creating a better society. Because these are some of the things that we potentially can put in place that will promote people's well-being and reduce their risk of experiencing a mental health condition like depression and anxiety. And there's a whole suite of things there that we can do to help improve people's mental health at a population level. But there's also an equal number of things that have a negative influence on people's mental health that we need to hone in on and tackle if we can. And the one I want to draw out to you there that is mentioned but probably really needs to be highlighted is child abuse and neglect. That is the single most, biggest cause of mental ill health globally in our community and in the world than any other factor. It's like smoking is to lung cancer or smoking is to heart disease and strokes. The WHO has estimated that 30% of all lifetime mental health conditions could be prevented if we eradicated child abuse and neglect. You really can't do prevention without a preventative mental health system, or what we prefer to call a mental health promotion system. We've got a mental health care system, but I really don't think we can say that we've got a mental health promotion or preventative mental health system, and we need to create one. And these are the building blocks of any good health or mental health promotion system. Basically, we have to have that set language, and we have to have a commitment, and we need all those other elements: funding, governance, programs and policies and delivery systems, a workforce to do this work, good data, and an emphasis on research. Because at the end of the day, this is what we're trying to create. A single system with two components. A component that happens in the community, that's focused on addressing those risk and protective factors in the places where people are born, where they learn, where they work, where they grow, where they live, where they play. And a mental health care system that's able to deliver early, effective, comprehensive, holistic care for people who have developed a mental health condition. Good mental health policy is not just about supporting individuals experiencing mental health challenges. Critical and important though this is, it's also about promoting and protecting the mental health of the entire Australian community.
So I am a clinical neuropsychologist, and I run lots of wellbeing programs for organisations, and my business really kicked off during COVID, as you can imagine. What I've been finding recently with the new code of practice is that a lot of employers and employees are confusing psychosocial hazards with psychological safety. But one of the things I'm doing now with organisations is helping them understand the difference in that psychosocial hazards are anything to do with something that could impact someone's health, so induce stress or reduce their abilities to cope. So any aspect of work design or the work itself or interactions between employees. For example, a high workload can cause fatigue and then lead to risk associated with that. Psychological safety is different, and that is the belief that you won't be punished for speaking up to your leaders in your organisation. And the degree of psychological safety that employees have will determine how successful we can be in the identification of psychosocial hazards. So one of the things that I'm doing is working with organisations to help build trust, to help people understand the difference between these two things, and to get people to speak up. The other thing that came out recently, State of Mind report this year in 2023, looking at the key drivers of mental wellbeing culture in Australia and Australian workplaces. 7 out of 10 of the highest rated drivers were to do with leadership and leadership behaviours. And I think this is really important as well, because sometimes I go into organisations and I deliver a lovely workshop on workplace, mental wellbeing, but then, it falls down because leaders are not promoting this. We're telling people they need to look after themselves, have work-life balance, and then leaders are working until 8 o'clock at night. So the top driver actually that came out of this report was that leaders will do what they say they will do. So we really need to engage leaders if we're talking about promotion and prevention.
I am a dietitian, and I am co-founder of a program called Mood Food Nutrition for Mental Health, which is an evidence-based program using diet as both a prevention and a treatment for depression. Poor diet is actually the leading cause of early death around the world. We know that 35% of adults' intake comes from these highly processed foods, and our kids are eating even more than that. So 40% of their daily intake is coming from these highly processed, sugary and fatty foods. We also know that mental health disorders are the leading cause of disability around the world, and that science has linked these two things. So there's now a very consistent and compelling evidence base from right around the world and across the lifespan to show that unhealthy diets are consistently associated with an increased risk of depression, while healthy diets are consistently associated with a reduced risk of depression. We also see in our best practice guidelines from the Royal Australian and New Zealand College of Psychiatrists that our step zero, the first thing that we should be addressing when we are dealing with common mental health disorders, is the lifestyle factors, including dietary change. However, this isn't what we see when people first present with mental health disorders to their GPs and their psychologists. I stumbled across the work of Felice Jacker, who is here in Melbourne. She's a leading nutritional psychiatrist in this area, and she conducted the first randomised control trial, which set out to answer the question, if I improve my diet, can I improve my mental health? And amazingly, the answer was yes. There's been a lot of research that has followed on since then, showing the same thing, that approximately 30% of people will go into complete remission when improving their diet and following a Mediterranean-style diet. We also see in the research that there's an area of our brain called the hippocampus, which is really important for mood, memory, learning, and mental health. And we see that people with depression have a smaller hippocampus when compared to people without depression, and the same goes for unhealthy diet. So when people are eating these diets high in sugary and fatty foods, that hippocampus is smaller compared to people who are following a healthy dietary pattern full of whole foods, high in fibre. And really excitingly, we can see that area of the brain grows and shrinks when we treat depression and when we improve diet. So there's lots of different ways that food is affecting our mental health. We hope that we get to the point where we are addressing diet and recognising that the way we are currently eating is getting worse. Our global consumption of these highly processed sugary and fatty foods is increasing, and it's having a devastating impact on our mental health.
And I'm not going to say I am a mental health expert, but I tell you what, I have lived experience of over 40 years seeing what some of those issues that you've highlighted, Stephen, earlier have caused the eradication of spiritual connection amongst Muslim community in Australia and worldwide. The aspect of Islamophobia, terrorism, that Islam is about this, it's all about that reducing spiritual connection and religiosity to a space where, as a Muslim, you lose your own identity. We had our first National Muslim Women Conference in 1992. We spoke about them, exactly what you were talking about. Those contributing factors is to what could be causing that mental health illnesses amongst communities. But what we've done, we've turned it around and we've started talking about mental health and well-being. We've looked at it from an asset-based approach, taken back the Islamic principles back into our lives. And what we've done that is, because we've gone through so much trauma, we've done the first Gulf War, we've had the 9/11 attack, we've had the, so much that I personally have put them back in the back of my memory, but they'll come when I need to. And we've seen what it has caused to young people in Australia and worldwide. And the mental health and well-being of these young people has had a tremendous costing effect, economic effect on the country, as well as the lived way of social cohesive interaction. But when we came to, again, COVID hit us all together. So we were all united. We were all united in this, combating this worldwide. And what we were trying to work out is that how can we not repeat the same mistakes that we did in the early days? So what we were doing, we were actually documenting what was being said to us every day. So we were documenting lived experience. We designed a checking sort of strategy on all of our clients and the majority of the community. So we did sort of like a domino effect of positive interaction, where we got young people work with older people, older people working with other people utilizing the digital space. So the effect of mental health on young people was tremendously on high level. So we came up with a report called Hope Over Fear. So we were injecting hope in people's hearts, which brings me back to the spiritual heart. Here, the spiritual heart is so important and part and parcel of who we are. So how do we bring the whole aspect of a community with its diversity in a unique way, looking at identifying intersectionalities, of everybody, because we're not all the same, but yet we're so similar, right? How do we bring together from where my experience is working with women escaping domestic violence, and children being sort of like, they're victims of all these abuse. And we talked about the importance of having children, healthy minds, healthy hearts, healthy bodies. So part of what we do in our organisation in Muslim Women Australia is really tackling the holistic approach to being, B-I-N-G, who you are as an individual, and be humbly proud of being a Muslim young Australian. Identity and belonging is very important. And if we need to tackle, you're talking about early intervention and prevention and reducing harm. Why do we not tackle it from the way of life? Utilize that when we see policies being drawn up, in preventing domestic violence against women and children. When we say we want to eradicate that within a lifetime, a generation, right? Unless we tackle mental health from a holistic approach, we will never eradicate domestic violence, because that's inclusive of men. And men need to be part of the equation. I'd like to bring the spiritual heart to the space, and I'd like to be able to see that we bring the nurture, the transformative aspects of the heart, so that the mind and the soul can really work towards a better lifestyle, not just for me and us, but everybody that we come to. So really, we need to have power within, bring it forward together, and bring the heart into the space and move forward.
My name is Waminda. I'm from the Connective, and we're a interdisciplinary team that's coming together to look about how can the natural environment feed in and help our health and well-being. This is stuff that's sort of not quite at that forefront of thinking, but it's certainly something that's really emerging now. We know that there's this prime opportunity if how we engage with the natural environment can have fundamental outcomes for our health and well-being. We know that research is now showing that, as you know, if we can increase our canopy cover from 10% to 30%, tree cover from 10% to 30%, we can reduce loneliness by up to 25 to 50%. So staggering impacts. This is the area of work we know we need more clinical trials. We need more longitudinal studies, but the evidence is becoming increasingly clear that nature is a fundamentally untapped resource for our health and well-being, both for our physical health, our mental health, and our social health as well. We're starting to really try and explore how we engage with nature to improve our health and well-being. And the key thing, we know that nature, the contact of nature, being surrounded by nature is good for us. You know, just even vitamin D in the morning sunlight to trigger our sleep patterns or support our sleep patterns. But the thing that you'll hear us say again and again, it's just not the contact with the nature, it's the nature of the contact that really counts. And so this is about developing a much more meaningful relationship with the natural environment, one that really slows you down and really engages you. You know, we talked about mindfulness, we talked about sensory. We have actual 12 different gateways of connections that we use to connect people to the natural environment. And so we've actually designed a program at Nature Fix that's designed, we see it like going to the gym. When you go to the gym, you don't just look at the equipment, you just don't touch it. If you want to access the health benefits, you actually have to engage with the equipment. But if you really want to maximize those benefits, you actually have to engage with it in a way that develops a routine. It's regular, it's a routine. And for some of us, we don't know how to use that equipment. We might need a trainer or be guided instruction. It's exactly the same concept here, but what we're talking about is we've developed guided instructions or routines with nature that we know. We've dived quite deep into the research that trigger all these physiological processes through our brains and bodies that helps us to bring a whole range of mental health, increases in reductions in anxiety, increases in mood, increases in well-being, as well as physical health benefits. Can we start thinking, we're surrounded by nature. We don't access nature as what we could. Our routines or activities may seem simple, but it's not simplistic. There's a whole range of evidence to say, and compelling evidence to say, that engaging with nature in a meaningful way can have some profound health benefits. And particularly thinking about in the areas that need it most, there's social inequities that we can overcome if we can access the health benefits of nature quite rapidly and readily.